Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com.
Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and Medical Director, Dr. Randall Juleff of the Vein Clinics of Hawaii.
Okay, so sometimes we have a top 10 list, and sometimes we have a bucket list, and sometimes we have other things. And welcome to this show. We try to give you as varied a look at vein disease as we can. And as you know, a lot of things that we talk about on the show are fun. And a lot of them are pretty serious, and hopefully you learn something each time. I know I do. And I'm not only the facilitator of the show for Dr. Juleff, but I'm also a patient at Vein Clinics. And a lot of the things that we're going to talk about today are things that got me interested in this thing. So it'd be impossible to do it. I know it would be. We really need the top 5,000 things to know about vein disease. But today we're going to work on just 8 of them. So I think we can handle 8 at a time. Sounds pretty good.
Yeah.
So, it's and I do know that the first line in the materials you sent me are varicose veins are just the tip of the iceberg. Isn't that interesting? Because what starts out as something that you see on your leg or your face or your arm or usually your leg is you're curious about it, and it could be the sign of something that you are in pretty good in trouble, or that you're pretty good. So I think we're going to see a little bit of both sides of it today.
Yeah. I like to talk about this kind of stuff in a general sort of fashion because a lot of people, well, most people just don't know, and it's not their fault, but then that's why we do this radio show to hopefully educate, because there's some misconception, and then there is a lot of just lack of knowing that, I have this problem, or I'm experiencing this symptom, people don't really know that it's due to, vein issues, and, vein disease these days can be very easily taken care of in a very minimally invasive fashion, and we can make people feel a lot better.
Yeah, that's, by the way, a huge, big curve. And one of the things Doc talks about often, so I get a couple questions even though we have a list today, is that I do know that they're hereditary, but I want to go back and say, okay, if they're hereditary, I get it. I was doomed because my mom had them, but why did she have them? Mm-hmm. Well, because her grandma. Well, in other words, let's get to the first case of this. Who is patient 0 in this?
Yeah, we need to get to that guy. Yeah. Gosh darn it. Yeah.
But it is just, I mean, first cosmetically, it's one thing, but it is just, once you start getting these symptoms and things, it's something that you have to, even though it takes a long time, which I'm sure you're going to cover, it really does need some attention once you recognize some symptoms.
Yeah. Well, right. I mean, and once people start to develop these things that are obvious, on the surface of their leg and have symptoms, or sometimes just symptoms alone, it is a significant medical problem, and it needs to be evaluated and treated for sure. So, one of the first question, where you mentioned the first comment, varicose veins are just the tip of the iceberg, and I get this misconception all the time because people come in often because they have achiness and heaviness, but the thing that they see on their leg is varicose veins. Right. So they kind of immediately, since that's what they see, they're immediately thinking, okay, well, I've got this achiness and cramping and whatever because of the varicose vein. Yeah. And sometimes the varicose vein can be a source of symptoms, but again, it's just sort of the tip of the iceberg. the varicose veins are really just another sign or symptom of this thing that we call venous insufficiency, and that is the underlying problem that results then into symptoms and surface. So so what is venous insufficiency? Well, venous insufficiency just means that the veins in our legs aren't working the way they should. Veins are the blood vessels that carry blood back to the heart, so veins in our legs should be carrying blood consistently upward on its way back to the heart. And when some veins fail, and typically it's not all of the veins in our legs that fail, it's just a small number typically. But when those veins fail, the blood actually starts to go in the wrong direction. It starts to go downward rather than up, and that is then what leads to the symptoms. Now, why does the blood at some point decide that it's going to go in the wrong direction? Well, what happens is that there's a failure of one-way valves. We have a whole bunch of, tiny little one-way valves in the veins throughout much of our body, but they're the most important in our legs because we spend most of our life in an upright position, and the what we call hydrostatic pressure is the greatest. The lower you go down, and so the lower you are in the leg, the even more important are those valves. And what happens is that those valves fail.
And by the way, gang, I love this part of it because I liken it, because I'm a fisherman. If you listen to our fishing show, I look at it as the salmon going upstream. Every time the salmon can get and leap over that next level, it's free to continue on its way to get up to the top of the river and spawn. And if it can't, it's because they haven't got the energy to jump up there. In other words, it's failing. Something, their ability. And isn't it interesting? Once they get up there and have their babies, they die. But I get it, and maybe that's what a lot of the symptoms come from, the fact that you got swelling and things going on because you're just accumulating all of this fluid in your legs.
Right. Yeah. And that's a great analogy for sure. As those valves fail, it makes it much harder. Certainly for the blood to get upstream to where it needs to get to. So what are the other things that can be caused by venous insufficiency? And again, I think most people in their mind, they connect varicose veins with a vein problem. They don't know exactly what's going on, but they say, hey, I've got varicose veins. That's why I came in and my legs hurt and they're swelling and whatever. But sometimes varicose veins aren't a part of the picture. But this thing that we call venous insufficiency, that valve failure, can cause other symptoms and other problems. So what are they? Well, probably the three most common symptoms are achiness, heaviness, and fatigue. Those are the most universally present in most of the people that we are evaluating for venous insufficiency. They are also the symptoms that are most likely treated well when we treat people for their venous disease. Achiness, heaviness, and fatigue are those three symptoms that really are well treated from the procedures that we do. So you may not have a varicose vein anywhere on your leg, but if you have that achiness, heaviness, and fatigue, very likely you may have venous insufficiency. A couple of other problems or symptoms that we commonly see that, again, many people don't know that there's a connection are, muscle cramping and restless leg syndrome. Now muscle cramping is, again, it's Charlie horse. Often it happens, in bed at night or early in the morning. People stretch and the muscle cramps. Well, that in muscle cramping in the middle of the night, especially in the older age groups. I hear this all the time in the elderly. It seems like muscle cramping seems to be a very common symptom of venous insufficiency in the older age groups, and you know, I feel so bad for those people because the older they are, the harder it is, the more difficult it is for them to contend with, you know, muscle cramping in the middle of the night. You know, what do you do? How do you get rid of it? You know, you end up, you know, having to walk around, and it may take a long time, and it's interrupting your sleep, and, you know, it really impacts quality of life. Yeah,
and, you know, it's unfortunate that a lot of people wait so long, you know, to get diagnosed and get treated. That's why we do this show, because you are, no matter who you are listening, you are experiencing some of this already. It may or may not be venous insufficiency, but you have a lot of these symptoms. That's what happens as we climb up the age chart. Some of these things starts bothering us. But I think it's so neat the way you explain this, because some of the things that you've talked about you wouldn't associate with a vein problem,
right?
You know, and until you don't really understand what's going on with you.
Yeah. Well, until you learn about it. You know, typically people aren't going to be learning about venous disease, you know, just on their own. So that's why we talk about it on the radio. But so, you know, cramping is a very common problem that people don't necessarily connect with venous disease. Restless leg syndrome is also, number one, most people don't know, they've heard of it, but they don't really know what it is. But as you know, restless leg syndrome is sort of a spectrum. You know, restless leg syndrome can be something as simple as, you know, you're kind of unconsciously, you know, moving your legs and feet when you're in a sitting position, and because you're contracting muscles, and when you're contracting muscles, that helps the blood flow up, and so it's a way of kind of unconsciously relieving symptoms. Or in people, I think. You know, the people sort of connect restless leg syndrome with sleep, and I think you know, people often when they first go to bed, they have a hard time getting their legs comfortable, so they're moving their legs around. Same thing, they're contracting the muscles, and that helps the blood flow through veins, and it helps relieve symptoms. So, restless leg syndrome is another one of those things. Swelling is also a very common problem that's associated with venous insufficiency. Swelling is important because it puts the patient in the next level, in the next clinical stratus for the severity of venous disease. You know, we talk about our, you know, clinical, our SEEP classification, and C1 through 6. Swelling is C3. So we've moved from, you know, C2, which is varicose veins, into C3, which again kind of implies, or more than implies, it indicates a little higher degree of venous insufficiency.
You know, I'm glad you said that, because I think that's one of the things that prompted me to get treatment, because you just think, why am I, you know, being swollen like this doesn't make any sense. I'm you know, I haven't been bitten by anything. It's nothing red. It's just swollen. What's the deal? And it hurts.
Yeah. And, you know, and unfortunately there are more things than just venous disease that can lead to swelling, but, you know, venous disease is probably the most, you know, common single thing that will lead to swelling of the lower extremities in most people. Then there are neurologic kind of symptoms: numbness, tingling, burning. You know, we hear people talk about that all the time. The people will talk about a rash, and it's a eczema type rash that people will get on the lower leg, you know, in the calf.
It can be very misleading, can it? That
exactly. People, again, I mean, they kind of relate that to a skin problem, so they go see their dermatologist. But, you know, that's something that we call venous eczema, because it looks like eczema, can be very itchy and stuff. So itching is another one of those, you know, symptoms.
And by the way, people fly on that stuff for months sometimes before they figure it out.
Yeah.
And everybody does that. I mean, it's look at my skin, I'll go get some cream.
Right, right.
And you get into the routine rubbing the cream so much that all you're doing is masking the fact that you got a big problem.
Right. Yeah. And you're not getting rid of the root the root cause. So and then there's something that we call skin changes, and as the venous insufficiency worsens and as it continues over the course of people's lives, they start to get this these skin changes, problems with the skin. And this happens to about 20% of all people with venous insufficiency will progress to, these types of advanced problems. And what do we mean? What do we mean by that? Well, the first thing that starts to happen is that there's a brownish discoloration or a hyperpigmentation of the skin, again, of the lower part of the calf, and it can work its way up. A lot of people associate that brownish discoloration of the legs with diabetes, or other things, just being out in the sun a lot or whatever. But often it's due to a problem with vein function. So
I've learned with patients that I've talked to of yours and friends of mine is that's in the very beginning. What everybody says, well, it's just I'm sunburned, or this can't be this, it can't be that, and so you need to go. Sometimes by the time somebody finally sees a vein specialist, veinclinicsofhawaii.com, by the way, that it's been a long time that they could have been relieved a lot sooner had they recognized what some of these signs.
Sure, and maybe not have gotten into those higher
into the next category. Sure.
So the skin becomes brown, and then it becomes thickened and fibrotic, and ultimately it loses its ability to heal. So typically people will have these skin problems and then injure themselves in some minor sort of fashion. Hit the coffee table or drop something on their leg, and the skin breaks, and then it won't heal. And then it turns into something that we refer to as an ulcer or a chronic ulcer, and basically that just means that there's a disruption of the skin, and it's not healing the way it should. And what I usually tell people is that normal wound healing means that you hurt yourself in one way or another, and you may go through kind of an acute phase of redness and tenderness and over several days, but then after that, then you should start to see a gradual improvement in and characteristics of that wound or that injury healing. Well, if you don't see that, if you see a wound that is lasting for 4 to 6 weeks and it doesn't really look like it's moving in the right direction,
even that seems like so long.
Yeah,
but, it's amazing, gang. And I've actually experienced this in Doc's office talking to other patients. Some people, and I thought I waited a long time. It was about a month. Yeah. But some people, they just keep waiting and waiting. And I'm not trying to be humorous about it, but I mean, honestly, they after they get it finally treated, they feel so relieved because they just didn't know that they've gone through 5 boxes of bandages and 10 tubes of this and 10 tubes of that, and it's getting worse.
Yeah, and that's just it. They just don't know that there's a remedy, and it has to do with their vein function, et cetera. So it can lead to chronic ulceration. Yeah, I mean, actually, even a month. Many of the patients that we see that come in with venous, what we call venous stasis ulcers, they can be struggling with those for months, very, very, very commonly months. So, but yeah, it's a very grateful set of patients, and that's why I love treating some of those people, because you get them healed and they're very, very happy, obviously. So, and then, like I said before, some people may have no outward signs of venous disease at all. They may not have a vein on their leg. They may, their legs may look perfectly normal. But you can have underlying venous insufficiency that is actually causing, substantial symptoms. Now, does that happen, in the majority of people? No, it's, infrequent, but it's a possibility.
Interesting to me on that is that, I think even more credit be given to a patient that doesn't have some wide open, completely identifiable, symptoms. But when they find their way to a specialist, they have really saved in down the road. They've saved a lot of time.
Yeah, they've saved themselves probably a fair amount of misery for sure. Yeah. Okay, so that was number one of the 8 things. So what is the second one? Well, the second one has to do with the people who are the most likely candidates of developing this thing that we call venous insufficiency. The question here is risk factors. We always talk about risk factors of this disease process or that disease process. And so for venous disease, again, as we've talked about on a number of occasions, genetics is first and foremost.
Number one.
Yeah. So, typically we inherit the propensity to develop venous insufficiency. And actually, we were talking about valves, the one-way valves before, and that's what it is. We're inheriting the propensity for those valves to fail. The vein dilates, the valve fails, and then we go down the path of venous insufficiency or venous reflux. So, that's the thing that we inherit. And if you have one parent that has had a history of venous disease, your chances of you having venous disease is about 60%. So it's a little bit greater than 50-50.
I feel a bad number coming on here.
Yeah, so if you have both parents, then it's upwards of 90%. So if both of your parents have had venous problems, then it's almost a foregone conclusion that you will probably have some problem with vein function at some point along the way. Now, does that mean that everybody that comes into the office, can they identify a parent or a family member that has venous disease? Well, no. We have a good number of people that say, gee, no, my parents were fine as far as I know, and I can't think of anybody. But, the genetics are such that it can, skip a generation or whatever. But typically it's going to be in there somewhere.
Yeah.
It's probably a very, very minimal number of people who just kind of have, what we would call sporadic venous insufficiency due exclusively to, their lifestyle or life occurrences or life events, etc.
Okay.
So
now the next one I see, and this is going to be my question, but it's already here. It's age.
Right.
And because you said many, many times, and gang, if you go to veinclinicsofhawaii.com, you can find out a lot more about what we're talking about. But one of the things that's amazing is the older we get, the more likely we are to have things go wrong with us. But the fact of the matter is, in this disease, it actually starts before you know it, doesn't it?
Yeah.
And
right.
most of the time, you have it for decades sometimes before you even know you've got it.
Exactly.
That's very cruel of it to do that.
Yeah, really very inconsiderate. But age is a risk, but age, I always look at age as a risk as being the fact that, you're further down the timeline.
Yeah.
And, if you have the genetics, if you have the other risk factors that the longer your life goes on, the more likely it is that you're going to develop it. So,
well, in one respect, I mean, everybody knows that as you get age, your eyes start to get a little weak, and your hair starts coming out. Then you got your teeth are all jammed up. It makes sense that stuff you can't see is also suffering the same thing. Age,
sure, Age is a cruel thing. So, so another risk factor is female gender. Now, I think typically we talk about the fact that venous disease happens more frequently in women, and that's one of the misconceptions is that venous disease happens primarily in women. It does not. If you look at a large group of people, statistically, women have a little higher incidence, and that has to do with the hormonal changes that they go through over the course of their life. It has to do with the fact that they go through pregnancies, and we'll talk about pregnancy in just a minute. But Women do get venous disease a little more frequently, but I got to tell you, we see a lot of men in our office.
I'm telling you, when I'm in your office, believe it, I don't think it's quite 50-50, but it's pretty close.
It's got to be close.
Yeah.
I really need to. Need to look at that sometime, because day in and day out when we're treating people, it just seems like we have nearly as many men as women. And sometimes they're the ones that have much more severe type of disease.
Yeah.
As a matter of fact, the patients that I've seen, over the course of my career, the folks that have had the worst, especially varicose veins, are males. Not only are they males, but they're young males.
Wow.
Mid to later 20s or early 30s. It's an equal opportunity disease process.
But I also think that maybe it may be slightly more balanced because, men and women are really a lot more similar than we think. But I think that the women are probably a little bit more conscious of it visually.
Yeah.
And particularly in places like Hawaii, where we're outdoors a lot and we're wearing shorts and bathing suits, and sometimes men, if they can't see them, it doesn't bother them. Mm-hmm. And a lot of times these things that you're seeing are on the back of your legs.
Yeah, right. Yeah. I think women are more concerned with the aesthetics. Women tend to seek medical care for everything a little sooner than men. We see a lot of men, and I think it's probably, as time is going on, for a long time again, I think most people's conception was that, vein issues were cosmetic and women were the ones that, were treated for it. But, as time goes on, I think men are becoming much more likely, to come in and, be evaluated. So, and hopefully us talking about it helps. People who have had a DVT, a deep venous thrombosis or a deep vein blood clot, those people have a higher risk of developing venous insufficiency at some point in the future. Obesity, we see a lot of people who are overweight, and so obesity plays into the breakdown or the failure of vein function. Part of that has to do with the fact that there's a greater intra-abdominal pressure. Mm-hmm. And when there is a greater intra-abdominal pressure and also pelvic pressure, which is where those big pelvic veins are draining, or the leg veins are draining into the very large pelvic veins that go up through the pelvis and abdomen. And when there's more pressure on those, it's just creating more work for the veins to overcome that pressure and for the blood to go in the right direction. So that's part of it. And then also the fact that, especially in our obese patients, they have something that we call lymphedema, which is something a little different, but it's very, very intimately connected with venous disease. Lymphedema and venous insufficiency go so hand in hand that that's something that kind of and lymphedema and venous insufficiency kind of go hand in hand with obesity. So that's a very strong risk.
By the way, a price you need to pay sometimes is at the end if you are obese and then later on are not. Yeah. Because of whatever, bariatric surgery, losing weight. Some of the things that you got when you were obese don't go away.
Yeah.
You're a thin person with lymphedema, which is usually something that goes more towards somebody who's bigger. Sometimes it can be very cruel.
Yeah. Unfortunately, you are absolutely right. Absolutely right. So, so pregnancy is a risk factor, multiple pregnancies. And, I think each time a woman goes through a pregnancy, there's more wear and tear on her veins. And, we've talked about, we spent a whole show talking about, pregnancy as it relates to venous insufficiency. But the thing there is that also during pregnancy, obviously, as the uterus is getting larger, there's a increased pressure in the lower abdomen and pelvis that is impeding, vein flow through those very large pelvic veins. And that is going to, again, put undue pressure on the venous system and will lead to some amount of failure. During pregnancy, there's an increase in blood volume.
Yeah, I was going to ask you about that. The volume of blood, more blood.
Yeah,
so everything's got to work harder.
Exactly. Yeah. And blood volume increases by about 50%. So that's a lot. Yeah.
By the way, we should give women a standing ovation for going through what they go through, because you and I would not do this.
I'm glad that men can't get pregnant. Yeah. So, and then also hormonal changes that happen. There's the tremendous hormonal fluctuations that occur during pregnancy and immediately thereafter, et cetera. So, the hormonal changes, actually what happens there is that it makes not only veins, but also a lot of different types of tissue in the body more lax. And veins fall under that category, so they tend to dilate and become, functioning abnormally. And then the last couple risks are careers. Mm-hmm. People who are on their feet a lot, and we see a tremendous number of people like that in a place like Hawaii because of the numerous restaurants and bars and resorts and all that sort of stuff. So people, a whole bunch of people work on their feet,
and they choose it. They got great careers. I mean, even know we've talked about this before. You have a lot of patients that are doctors, dentists, and others that really they really stand up 8 hours a day.
Dentists. Many doctors. I mean, for many years I was in the operating room.
You were that guy.
I was one of those people. I guess I still am, quite frankly. But so career matters, and then height. Actually, taller people have a higher risk of developing venous insufficiency. So if you can, try not to be too tall.
Yeah, don't grow anymore. Stop. But it is interesting because I think particularly a lot of height. I mean, I know a lot of guys in there, that I played, when I was playing football, guys are 6'4", 6'5". Some of these guys are big guys.
Yeah.
And all of them end up with back issues and usually vein issues.
Right.
Maybe there's just so much of it.
Very common. Okay, so number 3. We're up to number 3. And that has to do with, are there ways to prevent venous insufficiency? And unfortunately, the short answer there is no. There really isn't a way that we can actually prevent it. Are there ways that we can potentially or hopefully alter the course? Well, yeah, there is, and our old friend compression stockings are right on the top of the list.
Number one. Yep.
And is even compression stockings, is that going to completely prevent? No, but it could probably lessen the extent of venous disease that any one person may develop. It will certainly postpone, I think, it getting to a significant level. And where would this be? Where would this come in? Where would this information come in handy? And I think for those people who they have venous disease and they're trying to maybe give information or recommendations to their children. I think that if for those young people, probably especially young women, if they have two parents who have venous disease, then maybe even before they start to have symptoms or findings, varicose veins, etc., it would probably be a good idea for them to incorporate compression stockings into their daily routine in one way or another.
Yeah, I guarantee you, because I feel this. I feel that if you have this compression, what you're doing is you're helping these weak valves of yours, because if the compression is such that it can almost power by the weak valve. I mean, enough squeezing, that blood wants to go up, and so that's maybe a big part of it.
It is, yeah.
And this next one is one that's always interested me, because you want to argue it, but then you're telling me it's not really arguable, and that's diet and exercise.
Yeah. Yeah, well, diet will have an effect in along the way of, if somebody's obese and if they diet to the point where they're no longer obese, that will decrease your risk. But diet in and of itself, if you If you alter your diet, is that in some way going to
there's
improve?
no vein food, right?
Yeah, exactly.
More carrots, okay. No.
Right, yeah. So, and exercise also, is physical activity good? Yes. Is muscular activity good for vein function right at that moment when you are exercising? Yes. But if you have a genetic predisposition, and if you have other aspects of your lifestyle that may be conducive to developing venous insufficiency, then probably an exercise program is not going to be demonstrably better or make a huge difference.
But it'll make you feel good, so go ahead and keep doing it. Yeah.
Well, but you can do. There's a lot of other reasons why you should exercise for sure. Yeah. I'm not saying you shouldn't exercise. So, okay, so what about medication? Well, there are a number of naturopathic type medications that some people feel do affect symptoms, and there have been, studies along the line of, looking at some of these things and seeing the symptoms that they may or may not help. There's a few things. Horse chestnut extract. Now, and I hear people ask me about that.
I bet they ask you all the time. I saw a little thing on TV the other night about that.
Yeah, right, that kind of stuff, or they heard about it from another physician. And horse chestnut extract is probably the most common thing that I get asked about. They ask me, do I think that they should take it? And I usually my answer is, well, yeah, if you take it and if it has a positive effect on your symptoms, then there's nothing wrong with it for sure. And there's a couple of other medications along the same sort of or in the same sort of fashion that some people might prescribe for the symptoms of venous insufficiency. And some of them have, again, statistically, when we look at this in a controlled study, some of them have had a significant effect on symptoms. What are the symptoms? Well, pain and heaviness are the two symptoms that seem to be utilized in some of the studies, and we see some improvement. Is it a great deal? Does it take it away? No, it doesn't, but it may help a little bit. Swelling is another one that, if on some of these medications, we may see a little improvement in swelling. But are taking those medications, is it going to cure somebody of their venous insufficiency? No, it's not. It may help the symptoms a little bit.
Do you think that's down the road? I mean, obviously, we've talked about this before. There are a lot of people in a lot of parts of the world that are working on all kinds of things. Look what just happened with the quick development of the vaccine for the pandemic. But I would imagine that down the road there will be some ways to do some sort of treatment or at least stopping it. But it doesn't look like there's anything right off the shelf that is an automatic, this is going to take care of it.
Yeah, not that we have right now. And I wouldn't, I'm not, not that we have right now. And I would say that probably it's going to be unlikely in my lifetime. But these medications are no better and probably not as good as, for instance, just using compression stockings. So compression stockings are much better at, relieving symptoms. And also probably there is like you alluded to before, there's a mechanical component to compression stockings that are benefiting, blood flow that I'm sure you don't see with these medications. The thing with venous insufficiency is that it's a mechanical problem. Okay. It has to do with those one-way valves are failing, and so consequently, typically it's going to need a mechanical remedy, not just a chemical one.
And we talk about that a lot, gang, when we start talking about treatment. And if you want to know more about that in advance, go to veinclinicsofhawaii.com and check it out. veinclinicsofhawaii.com. We want you to refer there. We don't bother with phone numbers. Too hard to remember, but you can remember veinclinicsofhawaii.com.
Right. Okay, next topic. Are there other health issues that can arise Because of venous insufficiency, and the answer to that is a definite yes, for sure. Most notably deep venous thrombosis, and we've been talking about that, and which is always good to talk about. But people with venous insufficiency have a 5-fold increased risk of developing a DVT over the course of their lifetime, as opposed to those people who do not have venous insufficiency.
Okay.
So, 5-fold increase is substantial.
A bunch, yeah.
And and that's one of the reasons why we treat venous insufficiency. I mean, when I'm talking to patients and they ask me, "Gee, doc, do I need to have this done?" And of course, the answer is, well, no, you don't need to do anything except pay taxes, and but
reluctantly as you might, but you do have to do that.
Yeah. So the answer to that is no. But one of the reasons that we do treat this is to not only treat the symptoms, but also treat the risk of DVT. We're eliminating that additional risk of DVT. DVT in and of itself can lead to poor vein function, and when people develop a deep venous thrombosis, the deep veins rely on these one-way valves also, and the valves get disrupted from the DVT, and it can lead to further problems with reflux and further overall venous functional problems. So we want to try to avoid that. There's something called post-thrombotic syndrome, and we talked about this a few weeks ago. And that was a patient that we had seen in the not too distant past that had a DVT. He actually didn't, recognize that he had a DVT, but he had developed this thing that we call post-thrombotic syndrome, and basically it just it's the same thing as kind of advanced venous insufficiency. All of those skin changes that we typically talk about, the discoloration and the thickening of the skin and the ulceration, etc. So that can be a byproduct of venous insufficiency in those people that develop DVT. In those people who develop DVT, they can also have this thing that we call pulmonary embolism. And pulmonary embolism is
scary.
A blood clot, a piece of that blood clot breaking loose and traveling up through the venous system and going through the heart and into the lungs, and people die suddenly from that kind of thing. So, as a matter of fact, 10% of people with a pulmonary embolism have a fatal outcome. So it's an important thing. That again, another reason why we should be concerned about venous insufficiency, because it can ultimately lead to these things.
And gang, we've done programs on that as well. And once again, Dr. Juleff is, of course, the medical director of Vein Clinics. And you can find this all on the website. And one thing we can tell you, there's no silly questions. Everybody that has some sort of a symptom, you go online and get the phone number and call up, make an appointment, get seen, and get counseled, and find out where you are on this thing. VeinClinicsOfHawaii.com.
So chronic venous insufficiency can also lead to superficial venous thrombosis. There's deep venous thrombosis, and then there's superficial. And superficial venous thrombosis typically is a sudden clotting off of superficial varicose veins. I mean, typically that's how we see it happen. And we talked about this also recently, is in light of the fact that superficial venous thrombosis is something that we sort of blew off before. We kind of minimized it, but it really is nowhere near as benign as we once thought. But acute episodes of SVT can be very symptomatic and can interfere with lifestyle for a while. It can take a while to resolve. SVT will lead to DVT, so superficial clot can lead to a deep clot, which is even more lethal. About 25% of the time.
Yeah, so that's a major warning signal.
Yeah. About 5% of superficial blood clots are associated with pulmonary embolism. So again, these superficial blood clots are can be damaging and even fatal in very, very few. But again, nowhere near as benign as we thought they were. As the process progresses, again, we can develop skin problems that we've talked about that lead to chronic ulceration, and chronic ulceration is something that this country spends billions of dollars on every year. Yep. For the treatment and the loss of work and hospitalizations and surgical procedures and all that sort of stuff.
Yikes.
So.
Yeah, and the list goes on there, gang. So that's when you when you look at these different stages of embolism. I mean, not embolism, of venous insufficiency. This cash register starts ringing. So the more you do, and the earlier it does, the better you can either deflect that or defray it completely.
Mm-hmm. Yeah. Okay. So next item, number 5. What are some of the things that can be done for venous insufficiency? And these are the things that we do every day, all day long.
How we treat, yep.
And so one of the basic procedures that we do is something called endovenous ablation. And what does that mean? Well, endovenous ablation basically means that we close a vein down. So if a vein is not functioning properly, then we close it down. Why do we close it down? Well, or why don't we repair it? Well, unfortunately, we don't have the technology at this moment to repair what would need to be repaired to fix, for instance, a saphenous vein. We talk about these one-way valves, and these valves are just very, very tiny little wisps of tissue. When you look at them, in real life, and when they fail, it's just not technically possible at this moment to surgically repair those tiny little valves in the superficial vein. So rather than doing that, we close the vein down. And
the good news is it makes new ones, and no amount of treatment is going to get you to a point where you don't have enough veins anymore.
Yeah. And basically what's happening is that when we close a vein down, we're forcing the blood that would otherwise have been going through that vein.
Got to go somewhere else.
Yeah, to be rerouted to normal vein. Mm-hmm. And when it gets rerouted, then it comes back up to the heart the way that it should. And the reason that works is because we have many and plenty of veins, alternate veins in our legs that will easily take over the work of the ones that we're closing. And I get that question all the time.
Number one, I guess.
Yeah, it's like, gee, doc, isn't that going to hurt me if we close the vein down? And I say, well, no.
It's the opposite.
Actually, it's going to help you.
It's going to help you.
And then the next question is, well, gee, isn't that going to overpower then the veins that you're rerouting the blood to? And the answer to that is no. The veins that are there that are taking over the work of the ones we're closing easily take over, the flow, and it does not affect their function at all. So what are the things that we do? Well, there are thermal ways that we close veins, and that basically that has to do with laser. A laser fiber that we put in the vein, or what's called a radio frequency device. Both of those heat up the inside of the vein and cause the vein to close. So we're closing the vein. We're basically cauterizing the vein from the inside. And when we
amazing, by the way, the equipment. If you had surgery years ago, your mom or your grandma, it's a whole different thing now. You walk in, you walk out.
Yeah. So we use the thermal devices to ablate veins in some areas of the body in some settings, and then there are a number of non-thermal devices or processes that we can use to close veins also, and in different situations we use either one or the other, whichever is the most optimal. But how do we do that in a non-thermal fashion? Well, there's chemicals, and there's actually a biologic glue that we're using these days to close veins, and then a couple of other devices that kind of use a combination of different things. But so we use whatever device is the most optimal for that patient in that situation.
Interesting to me, gang, and I've learned this over the years that a lot of the stuff we're talking about has been developed within the last 30 years or so. So I mean, there's been such tremendous improvement in the treatment of this disease based on the need to do things a little bit differently, and it certainly is working. I would imagine, Doc, that a lot of the people that we talk about on the show that were previous, vein surgeons, they would say, "Wow, I can't believe you guys got all that stuff now."
Yeah. Yeah, it's really nice, which is, and we've talked about this before, one of the reasons why I decided to kind of, further specialize, within the vascular realm to just venous diseases, because there's so much new stuff going on, and it's really been exciting to see it, kind of unroll in the last 20 years or so.
And this is why, gang, if you take a look at this, and I hope you can see this list one of these days, is that there are so many arrows in the quiver now. It's a matter of diagnosing and treating and deciding what's happening. And you could use, that's the gift that you have, that you decide what that specific patient needs for what specific thing, and it may not be the same thing over and over again. Might be something totally different each time you visit.
Yeah. So we do endovenous ablation. Another thing that we do is something called microphlebectomy, and microphlebectomy has to do with getting rid of varicose veins specifically, and we do this very minimally invasively also, which, by the way, everything that we do is minimally invasive. We don't make big incisions anymore. Everything we do is just through little needle puncture sites. But to get rid of varicose veins, we numb the area up real good, that we'll be working on with a local anesthetic, with a numbing medication, and then we make just little tiny needle puncture sites that we go through the skin, and we have special instruments then that we go through those puncture sites and are able to extract the varicose veins, and it does a very, very nice job. And those little needle puncture sites are heal nicely, and cosmetically it gives a very, very good result. Now, in some settings, people are not doing microphlebectomy, and I have found that getting rid of the varicose veins, as opposed to just treating the underlying reflux and hoping that the varicose veins go away, are that number one, it gives you a much better cosmetic result.
Of course,
but also you're eliminating the possibility of those varicose veins being a problem with superficial venous thrombosis and all this other stuff. So in my mind, it's important to get rid of the varicose veins. And then we do sclerotherapy in a variety of different ways.
That's what I've had. I love that, because it has a start, a middle, and an end.
Yeah. So what is the treatment experience? Well, people come in, and we have a fairly routine way of evaluating them. We do a history and a physical. We find out about their family history, find out if they've had any other further or any other treatment for venous disease in the past. We do a physical examination. We look at their legs pretty extensively and figure out what the signs are there, and we put them on the the clinical spectrum. We come up with at what point they're at, which is a good thing to do with respect to not only trying to figure out the extent of urgency that there might be in treating them, but also it puts them on a timeline. It kind of puts them not only a clinical classification, but it gives us an idea about at what point in the whole scope of the process are they. And then we do an ultrasound. In most people. That gives us just doing the ultrasound gives us a very, very complete look at what the status is of their venous disease, And then we kind of go from there. We also make a decision as to whether something further might need to be done diagnostically. If we are concerned about the venous system higher up, we've talked about pelvic veins and abdominal veins, and sometimes they are a question. Sometimes they are part of the pathology. Sometimes they're a big part of the problem. And there are ways to do that. Usually we use CT scanning or MRI, but whatever we need, we do to evaluate them fully. And then sometimes we have to look at their arterial side too. But with our diagnostic modalities these days, we have a very, very complete way of showing us exactly what's going on, and that acts as our roadmap to figure out what needs to be done.
I'm telling you, we're going by leaps and bounds. And by the way, that's another very important part of it, Doc. And you sit down and talk about the insurance and what is and what isn't covered. And more of it, thank goodness, some of these insurance companies are understanding how important it is to deal with this.
Right. Yeah. By and large, Medicare and pretty much all of the major insurers cover all this stuff. The only thing they don't cover are things that would be considered completely cosmetic. And that basically for us, that's really just spider veins.
Yeah, those tiny little things.
Everything else is, medically important along the lines of venous insufficiency. So the insurance companies are going to cover that.
So all you got to do to get in the queue, and it won't be long when you get an appointment, you get in there. It's time well spent. It's on 4 islands, but right now we're talking about here in Honolulu. But you can go online and see Vein Clinics of Hawaii. That's veinclinicsofhawaii.com and learn a little bit more about this. And, we hope to see you again next time. In the meantime, once again, it's veinclinicsofhawaii.com. We'll see you around the bend.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.